Again, good morning. Thank you. My name is Tracy Gardner. I work with the Legal Action Center, which is a law and policy organization here in New York and in DC, and we're the country's only law and policy organization that focuses on criminal justice, addiction, and HIV issues, the stigma and discrimination, and the policies and problems that impact people who are affected by those issues. And I can barely contain my delight at the opportunity to moderate this morning's panel, The War on Drugs as a Challenge to Community Health. We have an amazing panel, completely appropriate and wonderful to kick off the conference. We have the good fortune to not be the after lunch carbohydrate panel, but we are the morning caffeinated panel. I would strongly encourage you to read the extensive bio section in the program so that you know who you are being, the treat that you are enjoying in terms of the panelists. But I will introduce the panelists because we have a method to our madness for this morning in order to send you out for the rest of the conference buzzing and ready to take action. As you know, and as Dr. Roberts mentioned earlier, we are in the midst of and in the aftermath, in many ways, of a second Reconstruction put upon by mass incarceration and the malevolent orphan, the war on drugs, which is a war on people and a war on communities. Dr. Drucker is going to talk a little bit about some changes that we are seeing dramatically in New York. And what is true around the country is that crime is dropping in some places. Prison has been proven to be not as effective and terribly expensive, and so states are cutting back. In New York, 22,000 people come home a year. The health in prison reflects the failed priorities. We prioritize drug war and policing over education, jobs, and community health. And we have district attorneys who provide the sports opportunities for our kids and our communities. I'm just going to, again, talk a little bit about the rationale here for this panel and the speakers. Dr. Hart, Dr. Carl Hart, will be giving us our framework. How did we get here? Jennifer Lorvick will talk about the consequences of the war on drugs, in particular, focusing on drug users. Dr. Carla will talk about Chicago and New York and the impact on youth and how young people in many ways are set up to be destined to be caught up in the prison industrial complex. Dr. Amani, Bita Amani, will talk about health disparities and incarcerated youth, the impacts when we've failed. And then Dr. Ernest Drucker will talk to us about options for next step and taking actions. We hope to have some time for questions. There are some PowerPoints. You won't be oppressed by the PowerPoints, but there are some PowerPoints that the speakers will be using. And I just ask that people get ready to be enriched. So thank you.
Good morning, everybody. Thanks for coming out. I've been charged with trying to help us understand how we got here. That's a lofty goal. Actually, I think that's the point of the conference, right? So instead of being too lofty, I think that what I like to do is focus on the role of how the role that sciences play in terms of how we got here. The reason why we are here, or the concern that we have, is this issue surrounding mass incarceration when we use terms like mass incarceration, it implies that it is objective or it is evenly distributed. Of course, that's not the case. It's actually selective mass incarceration, given that most of the people who are impacted are Black and brown. So with that in mind, I like to think about my talk in terms of, well, I guess should give you guys a background. I recently wrote a book, and then when you write a book that's a trade book or a popular book, people oftentimes ask you to talk about things that you don't know about. So what I'd like to do today is maybe talk about something that I do know about, drugs and drug policy. So I like to talk about how drug policy has been used as a tool to further marginalize specific groups, especially Black folks. And in doing so, I like to briefly discuss the role played by many scientists who study drugs, because I know something about that. I recognize that there's plenty of blame to go around when it comes to bad drug policy and racist enforcement. But the reason that I like to focus on, well, there are two reasons that I like to focus on the scientists. First, I'm a scientist, and I know our role quite well. And as Baldwin has said, the price one pays for pursuing any profession or calling is intimate knowledge of its ugly side. And the second reason that I like to focus on the scientists is because our role is oftentimes overlooked in this sort of participation in the mass incarceration. We tend to think of science and scientists as being objective. Of course, science can be objective, and many scientists are objective, but there are times when this is less than true. I think a good starting place for me today is to think about the main assumptions that we make about illegal drugs, particularly illegal psychoactive drugs. The assumptions that we make often guide the approaches that we take to deal with drug-related problems. I say drug-related problems in quotes, because sometimes these things are not really problems. When I think about assumption, I think that I like to put forth an analogy that I hope makes my point clear. And I don't want to use this analogy carelessly or recklessly. I think that it's probably the best analogy to make it clear. A major assumption that guided the maintenance of slavery was that Black people were inferior. Now, this assumption was not only held by slave owners, it was also held by the slaves themselves. And evidence for this assumption was even collected by scientists. And I guess we can say that slave owners funded the studies, given that many of the slave owners, or some of the slave owners themselves, were scientists. So when I think about drugs, one of the important assumptions made about drugs is that drugs are so dangerous that we need to severely restrict them, and we need to severely punish drug law violations. Otherwise, our society will fall apart. Now, these assumptions about drugs, or this major assumption about drugs, is not only held by law enforcement, it's also held by people who use drugs, or people who have had problems with drugs. I think in part because this assumption allows people to explain away behavior that they don't understand, as opposed to thinking more carefully about what's really going on. And of course, evidence for this drug-related assumption is collected by scientists. And when I think about the slave owner analogy in terms of scientists, of course we don't have slavery today, but many of the scientists hold the dominant culture perspective, and they just don't think about these things in the way that people from my community think about these things. So now, when I think about the role of the scientists, I'm not saying that scientists intentionally engage in misleading the public. I'm not saying that at all. What I am saying is that scientists understand well the mission of the main funding agency for science, for the science of drug abuse research. And that main funding agency is the National Institute on Drug Abuse. And the National Institute on Drug Abuse's mission is to, well, I should take a step back and I should say that the National Institute on Drug Abuse funds about 90% of the world's research in this area, not just the United States, but the world's research in this area. And their mission is to bring the power of science to bear on drug addiction and drug abuse. Now, when we think about drug addiction and drug abuse, that's a very narrow, limited perspective of what drugs do and what drugs don't do. Particularly when we think about the fact that 80 to 90% of the people who use these drugs don't have a problem. 80 to 90% of the people who use drugs like heroin, methamphetamine, cocaine are more like the guy in the White House, President Obama, who used cocaine, marijuana when he was a young man. The guy before him, George Bush, used marijuana and widely suspected of using cocaine when he was a young man. The guy before him, Bill Clinton, used marijuana before becoming president. That's the majority of the effects that we see with these drugs. But when you have a funding agency that focuses primarily on this narrow aspect of drug effects, it skews the perspective of the population because this funding agency and the studies that are funded are published in our best scientific journals. But they start with this assumption that drugs are awful. So the best studies or the best information is published in these great journals. And then from there, they're published in your textbooks. And then from there, they're published in the mass media. Then from there, we get shows like Breaking Bad. We get all of these drug-related shows that are focused on this narrow percentage of drug effects that does not reflect the reality for the majority of drug effects. So when we think about that, the framing, our framing of drugs as being these horrible things, it makes it easy to pass legislation that we are all concerned about. Because we all, for example, or not all of us, many of you all are too young, but many of us have participated in the passage of the infamous crack cocaine, powder cocaine laws by saying that crack produced all of these horrible effects. Certainly some people who use crack cocaine engage in behaviors that disturb us, but I assure you, it's not the crack cocaine primarily that's causing them to engage in this behavior. Take it from me, someone who has given more than thousands of doses of crack cocaine in the laboratory without incident. I assure you, it's not the crack cocaine. We can go down the line of all these other drugs that concern us, and I can make similar statements. But I won't because we have a panel that they need to speak as well. I think that what I'll do is leave you with those thoughts, and thank you for your time.
Good morning. I want to thank the organizers for inviting me. Appreciate being included. It's quite an echo. Okay, so kind of from the big picture that Dr. Hart was starting to paint for us, I'm going to kind of get down to more specific examples of consequences of the war on drugs and community health from a study that I was recently involved in Oakland, California. I just want to share 3 observations with you today. The first is that one of the consequences of the war on drugs for people who use drugs is that the community becomes a criminal justice setting. And I'll give you some examples of that from Oakland. The second is that the war on drugs is bringing a lot of women directly into the criminal justice system, women who use drugs. And in this context, a lot of health needs go unmet. So Carl was just talking about NIDA, and this study wasn't funded by NIDA, but it could have been. It's an NIH study. And there was an initiative called Seek, Test, and Treat in Criminal Justice Settings. And the idea of this initiative was to address HIV infection among people involved in the criminal justice system. And as you probably know, the people in the criminal justice system are disproportionately affected by HIV. So in our study, we did HIV testing and counseling and data collection with about 2,100 people in Oakland over the course of 2 years. We worked in 3 separate neighborhoods. 88% of the people that participated were African American, so that's about 1,800 people. And I'm going to present just a little data about those 1,800 people a little further along in the talk. Just to talk for a minute about Oakland, this is the beautiful new span of the Oakland-San Francisco Bay Bridge. So Oakland's right across the bay from San Francisco. It has a remarkably diverse population. It's about 25% white, 25% black, 25% Latino, and then 25% a lot of other things. But in this context, there's also very distinct racial disparities in Oakland. In health, and income, in housing, and the African American population is most severely disadvantaged. Oakland recently received the dubious honor of having the highest robbery rate in the country, according to the FBI. So as I mentioned, the initiative under which we did the study was called Seek, Test, Treat in Criminal Justice Settings, right? And so there's 12 projects, and 10 of them work in kind of what people traditionally think of as criminal justice settings. So jails, prisons, parole offices, drug courts, a lot of good work happening in those kinds of settings. And we took a little bit of a different approach, knowing how far-ranging the impact of the war on drugs has been. We thought if we go to certain communities, we'd find very high levels of people with exposure to the criminal justice system. This is a parole and probation map in Oakland. I should mention one other thing about our community approach, is that we know that about 2 million people are behind bars, but there's another 5 million who are under control of the criminal justice system through probation and parole. So a lot of the criminal justice involvement that people are living with on an everyday basis is reaching into their lives in the community. So a lot of people get released to Alameda County and particularly to Oakland. And the dark area is the parts of Oakland where we focused our work. There's over 16,000 parolees and probationers in Alameda County altogether. Here's another look at the community as a criminal justice setting. These are arrests over a 2-month period in 2 of the 3 study neighborhoods that we worked in. The little handcuffs were not my icon. This is one of those web-based crime spotting maps, but they reflect arrests. So these neighborhoods are heavily policed, and anyone engaged in illegal activity like drug use is basically living under constant threat of arrest and incarceration, or more often reincarceration, right? So once we started our research, our strategy sadly was shown to be very correct. You don't have to go to jail, you don't have to go to prison, you don't have to go to probation office to find a lot of people impacted by the criminal justice system. So, I mean, these drug users, literally almost all of them had at some point been in the criminal justice system. And at the time that we talked to them, 40% had been involved in the system just in the past 6 months. So this is lifetime, but that indicates it's an ongoing feature in people's lives. Just to address for a quick minute the impact on women. So these are women who used, I don't think I ever clarified that the eligibility to be in the study was crack cocaine or injection drug use in the past 30 days. I apologize. So when I say drug users, those are people I'm talking about. So incarceration of women has shot up remarkably in the past 3 decades. Even so, I have to say I was shocked by the level of direct criminal justice system among women. Often we talk about the repercussive effects, and for example, 45% of the women we saw had a family member currently incarcerated, but there's also these direct effects that are growing and growing as a consequence of the war on drugs. So according to the Pew Center, about 1 in every 89 women is involved in the criminal justice system. And in this sample of people in Oakland who used drugs, it was basically 9 out of 10 women were in the system at some point. Okay, I want to talk a little bit about the health consequences on the war of drugs. This is an example of how incarceration follows people into the community. So this is a homeless encampment. It's one of the places where we recruited people to participate in the study. 71% of the people we talked to had a felony conviction, and 47% had a felony drug conviction. And as you probably know, this severely limits people's options in terms of housing assistance. So there's public housing, restrictions on public housing, restrictions on staying with family in public housing, and then for people with conditions like HIV or mental illness, there are programs for those people, housing programs for people with those illnesses, but often you cannot participate if you have a felony conviction. So this is the result. People are being pushed onto the streets. And I frame homelessness as a health problem because it's, I think, impossible to think of a health problem that homelessness doesn't exacerbate. All right, so let's talk about drug use and drug abuse. So everyone who participated was actively using drugs. So in theory, everyone would be a candidate for drug treatment at some point in their lives. And as we see here, far many more people had been in jail than had been in drug treatment. And then we looked at people who had been released from either jail or prison in the past 6 months. 94% of them used drugs again, usually within a day or two. 17% of them had received any kind of drug treatment. So maybe it sounds obvious, but jail is not good drug treatment. People, this draconian strategy of throwing people into an incarcerated situation where, they have to detox and clean up does not treat addiction. And that's what these numbers reflect. What happens is it just perpetuates the cycle of use and incarceration, drug use and incarceration. Am I okay on time? 3 minutes, ish. I think I'll be okay. And so I just wanted to talk about another health consequence. As you realize, as I mentioned, this was a study about HIV. So, and I'm really happy to say that the prevalence of HIV among the people we saw in these Oakland communities was low. It was about 3%. So that's the good news. We had a component of the study where we have a case manager working with people who have HIV to try to stabilize treatment, kind of as they cycle through community to corrections to community to corrections. So we have 20 people that we're providing case management for, and they're all triply diagnosed. They have HIV, they have mental illness, and they have substance use issues. Substance use issues are actually really kind of the least of it. And 15 of them are unstably housed. 13 of them have been incarcerated multiple times in the past 1 to 2 years. We've been following them. And people often get released from jail without their HIV meds. So you can see that the cycle of incarceration is not addressing the needs of people with HIV. And if you think about the other systems that could be addressing the needs of these people, it's crazy that it's the criminal justice system that they interact with most often. And this is just a quick example of what happens with incarceration and HIV treatment. This is a study done by Malloy that was in Vancouver. It's HIV positive injection drug users. They followed them for an average of 2.5 years. And basically what this says is the greater the number of incarceration episodes, the less likely people are going to be successful with their HIV treatment. And you can see it's a dose-response relationship. So I think Ernie will speak to this issue far more eloquently than I am, but looking at, the concrete effects of the war on drug users in one community, some things are fairly obvious. We need to make the community a place where people can step out of the criminal justice cycle instead of a place where it gets perpetuated, and prioritize systems that help rather than hurt. If you think about all of the encounters people have with the criminal justice system, if those encounters were instead opportunities to connect people to services that would support becoming successful in life rather than making it impossible, think of what we could do. I mean, if every time somebody got arrested, they got referred to drug treatment. If every time you came out of jail, you were housing was made available. If we look at these as opportunities rather than as just occasions to hammer down on people, we could be doing a lot of good. I'm gonna wrap up there. I just want to acknowledge my co-workers and the people who participated in the study and our funder. Thank you.
Good morning. I'm honored to be on this panel. Sam, thank you so much for the invitation. As an urban sociologist, I explore the experiences of marginalized individuals, groups, and communities in the United States and their interactions with social institutions that can simultaneously ameliorate or perpetuate social inequality. More specifically, my research to date has focused on the plight of urban adolescents, who confront daily the paradoxes of neighborhoods that can either nurture or arrest healthy development, school systems that can educate or criminalize them, police departments that can protect or harass them, and a justice system that can rehabilitate or further damage them. With the decline in crime, decline in state coffers, the shutdown in governments, huge shift in the penal population, we must ask ourselves, what will be the next iteration of this nation's carceral state? And the main part of my research is to think about the legacy of mass incarceration. And on this topic of legacy, to take it to the next level in understanding what the next generation will inherit, especially with regard to the social transmission of disadvantage. So today I'll take a few minutes to go over the research that I've been conducting in New York and Chicago, to think about penalizing places where we can see evidence of mass incarceration pervading the lives of these young people, the institutional linkages across various places, and then think about the implications or consequences. As schools and neighborhoods have become more securitized during the era of mass incarceration, I argue that certain youth end up on a carceral continuum in which supervision and surveillance exist at varying levels of severity. Foucault, and more recently, Lorvick have used this phrase, carceral continuum, to theorize about the expanding systems of social control that impact young, unemployed Black men in particular, and place them on a never-ending circulus between two institutions, the ghetto and the prison. My mission is to test and show evidence of this theory. So how does the journey on the carceral continuum begin? We might go to Brooklyn. Some communities have become so conditioned to the incursion of criminal justice intervention that this jail-themed playground, I don't know if you can see, jail is really inscribed on this playground. It looks brand new and beautiful. It remained on the grounds of the Tompkins Houses public housing project in Brooklyn for 6 years until media attention stirred action and made it so that NYCHA painted over the offensive facade in the spring of 2010. So it was there for 6 years, and we have to think about this, especially when this neighborhood sends the majority of Brooklyn people off to upstate prisons. So this is not anything that's abstract. It's not about play. This is about real life. So through this example and many others, young people are introduced to the criminal justice system without ever having to set foot in a criminal justice courtroom. So my two main lines of research explicitly investigate how structural institutions like schools, neighborhoods, and courts shape the trajectory of young people's lives. And I'm really interested in the role of race and its role in the experience of young people's experience of discipline, of punishment in their communities, in their neighborhoods, and at school. And on the second note is to understand what are the linkages across these institutions that may direct these young people further along the carceral continuum. So if we go from the West Coast, my research puts us in Chicago, but it also travels along the continuum of geography to New York City. And I'm interested in really talking about what's happened as a result of monumental transformations in Chicago in housing and schooling that creates the conditions where young people have a great amount of contact with police. So I look at multiple methods and use them to explore the experiences of young people's police contact, but also their perceptions of injustice. And in New York, I actually am taking it to the formalized justice system and understanding how young people come to this place. And we see the on-the-ground operation of the juvenile justice system. So again, how do we get from young people, Central High, 1957, being protected by National Guardsmen, to outside of Fenger High School in Chicago, where police surround the schools? There's a great story behind this in thinking of disinvestment in cities, resources that have been dwindling in our public schools, and that's shaping the lives that young people live in these communities. In Chicago, especially, because of the violence that exists on the streets that young people encounter every day, there's an embeddedness or incursion of police in spaces that would normally be reserved for educational pursuits, not criminal pursuits. The young people in my study, 9th and 10th graders who are in school, this is a a very conservative estimate of young people's contact with police, and we see that there are strong differences if we think of youth of being told off by the police or told to move on, being stopped by the police, being searched by the police. You see race differences with Black and Latino youth especially being impacted, but also white public school youth, which is about 9% of the Chicago population. So there's something different about the white students who remain in Chicago public schools if we're not talking about the 6 top magnet schools. But then at the arrest level, you see these divergences. And so here, if we're thinking of a conservative estimate of kids in school, we can only wonder what this means for young people who are out of the school context. And so from this work, as I understand youth contact with police, but also its impact on their perceptions of injustice, I see schools as showing that it can be a safe haven. It can be a safe space for young people, but schools can also be a staging ground for danger. Schools are the reason for many young people to cross boundaries of race, of gangs, of class, or perhaps to never leave their neighborhoods, to never cross these boundaries. So I think a lot about the school as an enduring sort of effect on these young people and their mobility, not just physical, but also social. We want to think about the paradox of the real violence that they may confront in their schools and neighborhoods and compare it to a symbolic violence of having paddy wagons parked outside of your school, having to deal with scanning as you enter this place, and what does that do in setting you up for education or to think about something else. And then finally, and more sadly, perhaps there's a protective effect to the isolation and sort of staying cloistered within under-resourced spaces. Kids know the dangers, they think, of what is in their communities, and some of them are afraid to move on. So the highest perceptions of injustice I actually found in my research were from the most advantaged kids, the Black and Latino youth, who moved across their neighborhood bounds and went to the magnet schools. They were much more incensed about injustice than the young people who stayed cloistered within. So this may help us explain why a person like TB, a young guy who was in 9th grade who said, "I've been searched multiple times, never arrested, but doesn't that happen to everyone?" He has no concrete knowledge that this is not happening to young people outside of his neighborhood. And so indeed, we must acknowledge that it is race combined with gender, age, class, demeanor, and place that determines who is and who is not ensnared in the ever-expanding web of police control. We should think about what this means for kids in North and West Philly, South Central LA, Memphis, Tennessee, and even here at Tilden Career Academy in Chicago, where they must reconcile the message that children come first, building for their future, but also first they must be searched. So this new panopticon is all too familiar if we understand these young people are stopped and frisked in neighborhoods and then subjected to similar practices at their schools, where we have metal detectors, the embedded officers, at least two in every Chicago public school, visual patrols where live surveillance feed actually goes to the police station from schools, and moving on. And there's a universal notion of this working. This is one of the more advantaged schools in Chicago, and you still see the metal detectors, you still see the same apparatus, but it has a different tone and a place that is, really focused on learning, instead of thinking of a school like this on the South Side where young people have to go through, but they also have to be patted down daily. Dwayne, one of the students at that school, says, "It feels like a prison, to tell you the truth. You have to stay in the classroom, use the bathroom when they tell us, eat lunch when they tell us. It's like a jail." They ask, "Well, what's your ID number?" when you're in the hallway, just like you in jail. You say your ID number, not your name. It's no different than jail. It's just that we up in here 6 hours a day, every day. That's why kids act bad. They feel like they're trapped. And so this may help explain why some kids may fulfill that low expectation and end up in an actual juvenile justice court. And my research has moved further along this continuum where we see a window into that process. And very quickly, I want to give you the kind of pattern of this. You can see that delinquency cases have risen and fallen with the national crime rate. We see that females are still a small proportion of the population, but they have increased slightly. As young people navigate through the system, there are race effects for who enters, who exits, and who ends up being securely placed in a facility. And so I'm really interested in the kind of interactional processes within the courtroom that help determine that outcome. So I have young people actually today in the New York courts documenting these standardized legal proceedings, thinking about what the client's offense was, writing this down on instruments that will capture the legal elements of this, but also they're capturing social interactions. Are judges speaking directly to the young people, or are they acting as if they aren't there? What type of narratives are being spoken about their home context? Is the judge saying, I can't send you home, I must remand you into jail because it's too unsafe for you to go back to your community? So the deficits within their home neighborhoods actually may contribute to them being further enmeshed in the criminal justice system. And so finally, as we go through these institutional processes of both legal and extra-legal outcomes, as we think of the links across institutions like schools and neighborhoods to criminal justice, we might want to move beyond these micro-level analyses to think about the macro-based interventions in the lives of urban youth. We must examine the fundamental relationships that Black and brown people have with the state. This is one in which the state serves so many integral needs that frequent and deep interactions are unavoidable. So public housing, state property is still your private domain. Schooling, who's left in the urban public schools? And finally, thinking about the welfare state. So this research moves beyond New York and Chicago borders for us to think about other places where opportunity is distributed via zip code. America's teenagers who daily seek safe passage as they journey from home to school are the guinea pigs for an enormous experiment in how we create or fail to create a citizenry that feels safe and that has faith in its country's institutions. We must reckon with the attitudes and experiences of youth today because that has the greatest effect in shaping the state of our America tomorrow. Thank you.
Before I begin, I'd like to thank the conference organizers for allowing me to join this amazing panel and participate in these much-needed conversations. I'm very honored and grateful to be here. What I wanted to share with you guys today is some of the work that I've been doing, trying to better understand the relationship between criminalization and health. My work in this area is based on scholarship and histories that come from many different disciplines. It's informed by the work of public health scientists who have consistently pushed us to broaden our perspectives, looking for the root causes of illness, such as Nancy Krieger. It's informed by medical sociologists who have tried to get at the relationship between incarceration and health by framing incarceration as the institutionalization of stress. And more fundamentally, it's guided by the work of scholars of science and medicine. Excuse me, I gotta write this right. It's guided by the work of scholars of science and medicine whose work has demonstrated the relationship between science, medicine, and public health and white supremacy. Specifically, it is work of these scholars that challenges me to be wary of a medical interpretation of social and political phenomena. And I'll talk more about this later on. A few years ago, I was fortunate enough to be able to team up with a dedicated and brilliant group of organizers, members of the Youth Justice Coalition, to work on documenting the relationship between criminalization and health. While they had been doing their own research in this area, wanting to better understand the relationship between the two, we came together and began crafting a larger health research agenda on this topic. Our first project was a youth-centered, community-based research project wanting to address the impact of incarceration on health. The funding for this project, which I'll go over some of the preliminary results later, came from the National Institutes of Minority Health. But before I go into details about our projects, I first want to discuss them with you, explain YJC a little bit more. YJC is a prison justice org in Los Angeles that has been relentlessly organizing against the mass criminalization of Black, brown, and poor youth. Since its inception, it has challenged the structural ways that young people are defined and mistreated through ongoing community organizing, research, and policy. I've been very fortunate to work with them and value our partnership greatly. Together, our research has some really important assumptions. I think that before we talk about health disparities, it's important we get into how we conceive of the problem. First, we believe that the institutions and structures themselves manifest sickness. They compromise wellness. Our work attempts to challenge dominant biomedical frames which center the individual as a source of illness. Together, YJC and I do not study and investigate the individual, we investigate the system. More specifically, white supremacy's pathologic desire for social control and how this social control limits people's opportunities for health promotion and instead promotes illness. We believe that this illness is a physical manifestation of social and political ills. And for me as an epidemiologist, this frame can be uncomfortable, right? Given the traditional methods that circulate and are considered valid within my discipline, this uncomfortable yet much needed departure from the traditional ways of looking at health, people, and society have really challenged me to better conceptualize what is health. Second, we don't believe that the criminal injustice system is the only state power through which youth are criminalized. We know that the healthcare state and its research have actively participated in creating ideas about what is and is not normal, labeling youth as deviant, determining who is and is not a criminal. And in a racially oppressive system, Black and brown people have had too many encounters with with what Dorothy Roberts calls racial medicine, whose scientific knowledge has transformed the ideas of what is disease, for example, schizophrenia, and informed the logical remedies according to its racist logic, right? The logical remedies that follow from its discoveries, such as psychotropic use, increased surveillance, and implementation of genetic technologies. So let me talk a little bit about this before I move on. For example, Jonathan Metzl in Protest Psychosis, How Schizophrenia Became a Black Disease, documents how schizophrenia, previously conceptualized as a disease associated with white women who were housewives, came to be associated with Black protest. Schizophrenia labeled Black men's rejection of racial oppression as pathologic. This racist understanding of resistance still persists today, and the desperate rates at which Black and brown people are diagnosed with schizophrenia, even though the prevalence of the disease between white and non-white peoples is the same. In terms of remedies on state-sponsored interventions for these racist ideas, Alondra Nelson recently wrote about how the Black Panther Party, along with other people of color organizations across California, protest the funding of a violence prevention center at UCLA that claimed to be wanting to better understand the biological causes of violence. As Dr. Nelson describes, one project in particular offered up lobotomies as a potential intervention for the biological problem. For those that believe that medicine has come a long way from the days of Tuskegee or the fabrication of illnesses such as pathologizing people's desire for freedom, the sad reality is that this is still ever present in how the healthcare state conceives of and gives out treatment. And I have, in the next two slides are some data documenting the relationship between criminalization and hospitals. For example, you see here in this slide that Black and Latino youth are more likely to be restrained upon admission to a psychiatric hospital, more likely to be restrained than white youth. You also see here that Asian or Pacific Islander and Latino nursing home residents are more likely to be physically restrained than any other racial and ethnic group. And I have here an example of how there's still the persistence of this idea that people of color somehow can tolerate pain better, or that if they complain about pain in an emergency situation, it's because they're trying to, get prescription drugs. I don't know how many here are familiar with the case of Anna Brown, who was a 29-year-old homeless woman who went to a couple of hospitals complaining of intense leg pain. The doctors couldn't find anything using the MRIs and thought that she was, well, I don't know what they think, but I assume they thought that she was making up the fact that she wasn't in pain. And instead of her having her issue resolved, she was taken to the local jail facility where she died a couple of hours later of a blood clots that had been in her leg that had migrated up to her lungs. Okay. Back to the assumptions that frame our health research project. YJC and I believe that the incarcerated youth do have poorer health than those who are not incarcerated. And we believe that medical resources given to these youth are inadequate, if not sometimes disabling. And you see here I have a list of health conditions that the literature has documented as being more prevalent amongst incarcerated youth. Dermatological, respiratory, dental health issues, as well as infectious diseases. In terms of mental health illness, it's estimated that 15 to 25% of incarcerated youth have a mental illness so severe that their ability to function is impaired. And it's estimated incarcerated youth are also estimated to be 10 times more likely to be diagnosed with a psychosis. In terms of substance use, the prevalence of one or more substance use disorder ranges from 31% to 62%. While we believe that these disparities exist and we do advocate for better conditions in confinement, we don't accept the faulty premise that the poor health seen amongst incarcerated youth is a natural byproduct of incarcerated youth coming from communities that are already burdened with poor health. We find the health literature to in fact be maybe timid, primarily falling on methodological limitations, saying that because they can't prove causality, there's this temporal ambiguity around what came first, the health disparity or incarceration, that they let confinement off the hook. And like I said, while we accept that young people are coming from communities with health disparities, we believe that this relationship is more sophisticated than simply a mere artifact. We don't see how these health analyses take into consideration that the processes that go on in prison also take place outside its walls, albeit on an attenuated scale. Rarely does the literature acknowledge how the posture taken against youth who are locked up many times can be seen in either the school system, like Dr. Shed just brilliantly explained to us, or the hospital. Or on the streets in highly policed communities. The literature does not demonstrate an understanding that it is a racially oppressive system intent on social control and organizing that is defining what is crime, who is a criminal, and organizing itself around the target. Okay. So we're critical of this lens being on the individual and not on the structural failings. Central to our analysis is how the generations of families who have also experienced police surveillance and incarceration are most likely to live without education, employment, to live within an education, employment, and medical desert. We see youth as part of these histories and not separate from it. We also see that the systematic dismantling of youth opportunities in the form of jobs and education youth centers has additionally compromised youth's health. Okay. So in terms of some of the mechanisms through which you see stress, or do you see some of the mechanisms through which we conceptualize incarceration causing poor health, I think that the work of Michael Massaglia on this has been really good, in which he talks about how incarceration itself is the institutionalization of stress and stress proliferation. Stress in terms of how the body takes it can create a whole host of immunological and physiological responses that makes its ability to both susceptible against disease and limits its ability to protect itself later on. Okay, I'm going to fast forward because I think I'm kind of running out of time. So here are some of the preliminary results from this project that we've been doing together. It's called Does Lockup Make You Sick? Okay. Some of the preliminary themes that have come out are that for youth who are incarcerated, it's difficult for them to practice coping skills while incarcerated, that there's stress around family separation and visitation, specifically if family visits are either denied them, or after family visits, there's stress from the fact that now they have to deal with the pain, that they can't see their family, that while inside, that they're missing important life events. There's also a high prevalence of high prevalence of violent encounters, of which youth are receiving injuries. And there's also the self-inflicting of harm to get attention for their basic needs. And then, not surprisingly, there's also the presence of illegal and legal drugs, which are readily accessible. In terms of the physical environment, not surprisingly, there's poor sanitation, with youth reporting pink eye and MRSA. There's poor quality of food, and so youth are reporting not wanting to eat the food or having dietary incompatibilities as a result of it. And upon leaving the incarcerated setting, the stress still continues. It's a stress from a lack of opportunities and time missed, the stress of being reincarcerated, from running from what they call enemies that were made from being inside, or being in a closed room or situation where once again they're reminded that there's a potential that their freedom could be lost. And in terms of health services that they're accessing outside, it seems that more youth are aware of where to get birth control and condoms than where they are aware of how to get like a physical checkup, which I think is a commentary on how we conceptualize youth health. I just want to read one quote from one of the interviews, one of the focus groups. It was between myself and 3 youth who had identified themselves as T-Dog, Larry, and Antisocial. I had asked them, what support systems or what things do you have out there that make you guys feel healthier? They replied, exercise. T-Dog replied, exercise. Larry said family, and Antisocial said freedom. Real fast before I end, I wanted to talk again about public health as being an option for us to understand mental health. There are laws out there right now, such as Laura's Law, which allows the court to order a small subset of people with serious mental illness who meet very narrowly defined criteria to accept treatment as a condition of living in the community. Nevada County has implemented Laura's Law and found 46% reduction in hospitalization, 65% reduction in incarceration, and a 61% reduction in homelessness. I got this from No More Jails LA. But if we're going to think about public health as a model, right, for understanding mental health and to decriminalize mental health, then I think that we have to also be wary of racial medicine. And specifically, how are we going to go about diagnosing who does and does not have mental health illness? And what technologies are we going to use in terms of determining who is and is not in a compromised mental state? And I have a quote here that I think illustrates some of the problems that we could potentially fall into. It's from Michael Smith, Dr. Michael Smith of University of California at Los Angeles. He says, because we have no lab tests, the only way we can test if someone is psychotic is if we use ourselves as a measure. If it sounds unusual to us, we call it psychotic. And right now, the men's central jail facility in Los Angeles, there's conversations around how is it going to be either expanded or redone. And one of the alternative models states that one of the old towers can be made into a mental health facility. And so I guess I want to end by asking, what would a mental health facility look like under the supervision of the Sheriff of Los Angeles? You know, is this public health? Is this what we're looking for when we talk about another way of looking at crime and mental health illness? Because if it doesn't challenge white supremacy, then if it doesn't challenge racial oppression, if it doesn't get at the heart of how incarceration and criminalization are about social control, then in fact we're very much in danger of not only not seeing these health disparities go away, but in fact reinforcing them. So thank you guys for your time.
Good morning, everybody. It's a pleasure to be here and to see so many dear friends and comrades in the group here. I hope to do a little more than preach to the choir, though. First, in looking back over the previous presenters, who I think do a very good job of mapping the critical analysis of the war on drugs in quite specific ways in their own work. Carl's discussion about this basic fact that most people overlook, the fact of that most drug use has nothing pathological about it at all. And it's a very common part of everyday life going back millennia in human society. And that the Institute, the largest research institute in the world supporting studies of drugs, has abuse in its name. And reasonably, the National Institutes of Health don't call themselves National Institutes of Disease, even though that's what they're there for. But that's carried over in the case of drug research, which therefore misses the reason why most people use drugs. It's to seek relief or enjoyment, perfectly reasonable motives that can surely go wrong and cause a lot of trouble in many ways. And that's what our focus should be on. And the name for that is harm reduction. And there are many important people in this group who've had a big role in building harm reduction as an alternative to the automatic and total pathologization of drugs. I think also that Jennifer Lorvick's talk about the relation to HIV and treatment and relates to other chronic conditions associated with poverty, which is what's happening with HIV in the world at this point, and drug use, is very important because it also touches on the issue of the way in which the interaction between the prison population in and out, with the difficulty of stabilizing life so that you can treat these chronic conditions. As a guy who takes 5 pills a day, I often wonder what would happen if I was arrested and couldn't get those pills. So for the people who are, we already know that that's a critical issue in their health. And hopefully the Obamacare, the ACA, will make a difference in that. And there are beginning to see signs of that. For example, in the state of Massachusetts, which has had something like the ACA in place for the last, how many years now? 7? Something like that. That there are multiple incidences of people who are now coming out of prison who go into a health care plan that covers them. And that's going to happen in other states, and something we ought to be paying attention to as we deal with these chronic conditions that are often treated for the first time when people go to jail because of the paucity of lack of health care in the poor communities most prone to trouble with drugs and trouble with prisons. I think that Carla's talk about the carceral state and its impact on youth is important because it touches on the social transmission of disadvantage. We heard Bruce Western speak yesterday up at Mailman on this very, very same idea, and beginning to look at the progression in families, multiple generations in jail, multiple generations under the control of the criminal justice system. And that's certainly a cumulative effect, conservatively affecting 20 million people in the United States now. The issue relation to violence and injustice, which are as evident in the criminal justice system as they are on the street, does not escape the attention of young people. And although they're often confused about what the genesis of this is, they certainly aren't confused about its existence, injustice and violence, in the systems that respond to injustice and violence in their own lives. So a lot of this, and finally Bita's comments about the stress and the institutionalization of stress in prisons, also very important because of bringing us back to the name of this conference, which has to do with punishment. And it's the most obvious, if you ask a fish to describe their environment, the last thing they'd mention is the water. And the idea that punishment, what punishment is, which we all know from bitter personal experience. All of us have been punished. All of us have been punished unjustly. All of us have been punished brutally in one way or another in our lifetimes. And so it's not a strange human experience, it's almost universal. And yet, the fact of punishment pretending to be, we're here to help you, this is rehabilitation, there's no sign of that anymore in the carceral state. It's a purely retributive system. And that's what a lot of my own interest in work is about now. Oh, we have the slides. Okay, this is in addition to shameless self-promotion, which my editor Diane here will appreciate, is a person very much responsible for many of the good things in this book, Diane Wachtel from New Press, that the idea that the punishment itself should be our focus, and we should make the same demands of that method, that approach to dealing with issues in our society. What does it deliver? What are its outcomes? As opposed to, well, this person did that, therefore they deserve this. And how many of us are really deeply committed to a retributive system of justice, which is not the only model in the world. In fact, the fact of the United States being a total outlier in the rate of the use of punishment should be a giveaway, when we're also a total outlier in the situation of health status for our people, especially given our wealth levels. So that part of this, and can I advance this by which one advances? There we go. So to change from the critical analysis, which I think has been so brilliantly done by my predecessors up here, is to look at, now how do we intervene? I'm a public health guy, and I'm interested, and I come out of an engineering background, which orients me towards solving problems and fixing things. And how does that apply to this situation? Where are the points of entry for what public health offers as a preventive model? That's what distinguishes it from medicine more than anything else. Its goal is prevention. And prevention has three dimensions to it: primary, secondary, and tertiary. Where primary is essentially preventing cases, secondary is treating cases, hopefully curing them, but often not, therefore leaving a residual of chronic disabilities or problems with chronic disease that is the subject of tertiary prevention. And that model fits very, very well to the problem of the criminal justice system when you view the criminal justice system in its metastasized form as a problem in its own right, a vast problem. However, it also happens to be a vast industry. And the commodification of this population, which we've also heard outlined, starting from youth and from particular neighborhoods, ain't going to go away so easily. They start threatening people's jobs and their economy, and especially these days, you have to think about how to overcome that aspect of resistance to change. Now, we're in the spectacular room, which looks like we ought to be passing laws, and since the people who we pay to do that have decided not to do it any longer, maybe we ought to think about what those laws would be if we could pass them in this room. Now, what I want to show you are some of in New York State, because I've worked here for 40 years on these issues, first in addiction treatment, then in AIDS research and prevention, and most recently in our criminal justice. What's happened in New York State it has a lot to teach us. And it starts with Governor Rockefeller signing the Rockefeller drug laws in '73, which became the model for so much of the punitive and retributive system of justice in place in the United States, but also very important because it outlined the political possibilities that grow out of adopting this model and building whole campaigns, political campaigns and careers around it. I recommend Jonathan Simon's book, Governing Through Crime, is a very, very good exposition of this. But what Rockefeller did was launch, at a period shortly after he became conscious of the spread of drug use into the white middle class community, a tough on drugs, tough on crime strategy, which has paid off very well for him and other politicians. And, but in New York State, almost within a year, at the same time these laws were being passed, people began to understand their difficulties, the problems they created, because they coincide with the introduction of methadone treatment in New York State. We went from having no methadone, the heroin epidemic was one of the stimuli for this, and we went from having no methadone treatment in New York State in the early 60s to having 30 or 40,000 treatment places by the early 70s when this bill was being signed, and people understood that. And the heroin epidemic had calmed down tremendously by virtue of taking these people who were seeking drugs in the street and doing crime to get the money to do those drugs, which offended many people, and methadone stopped that very effectively in that population. It didn't solve their mental health problems, it didn't give them homes, it didn't give them educations, but it neutralized the effect of having to be a criminal to have a drug that you needed every day, like I need my drugs every day. And the success of that program was not acknowledged or noticed. In fact, the vilification of methadone treatment has gone on apace in 30 years, taking the most successful, effective treatment modality we have for opiate addiction and considering it just more of the same, substituting one drug for another. And that's a damn shame, even in public health and medicine. A lot of people don't appreciate that. When are you going to get off that stuff? They tell a successful patient, and that's the staff talking. So here's the situation in reality in New York State of the effects throughout this era. For those who can't see the numbers on the bottom, it goes back to 1973. The red line on top is the number of arrests, peaking at 62,000 in 1988, which is the peak of the crack epidemic, and dropping off to about 40,000 today. Not today, actually it's 5 years ago now. It's much lower than that now. The green line, the middle one, is the indictments. So going through the court procedures to say, yes, there's a crime here, an increasing proportion of those were drug offenses, and hit their peak at the same time, and then taper off dramatically over the next 20 years, going down by about 2/3. And the final line on the bottom is commitments in criminal justice lingo. That's how many people go to prison on sentences, not the people held in jail temporarily in remand, which is Rikers Island. I'll say more about that. But reaching a peak of, these are new commitments, 11,000 in 1990 and going down to about actually under 4,000 today. The state prison population, I think it's the next one. No, it's not. Let's see. The state prison population peaked at about 54,000 at that time. No, excuse me, 74,000 at that same time, and dropped down today to about 50,000. It's been a 25% decrease in the size of the state prison population in New York, the greatest drop of any state in the United States. Now, go back to the model of prevention. Primary prevention is reducing the number arrested and incarcerated. If we apply a prevention model to the issue of incarceration and criminalization of people, and which by reducing that number, if we make that our goal, which has become a policy goal of many aspects of state government. I went to a city council meeting 2 years ago where they looked at the first results of the most recent set of Rockefeller drug law reforms in 2009, which took away mandatory penalties from a number of drug felony charges. And it was a celebration of success. Look what a good job we're doing. And everybody was on the program. And I think most people who've been working in challenging the punishment system don't appreciate that we have allies in the political process who are actually building their own reputations out of getting the size of the criminal justice system down. The police are not among those, largely, okay? Now, the next slide you're not going to be able to see, so I'm going to skip it and go to this one. Okay, here we go. Oh, well, you can't see the color, that's terrible. There's some faint blue bars there up on top, which peak up to, the numbers are clipped off also, the 50,000 level. But the size of the prison population overall went from having, these people are drug offenders in the state prison system. And it went from being about 40% of the system in 1990, early 90s, down to about half of that, to about 20% today. And the other part of it is still about the same size. In other words, the people who haven't gotten out of, who haven't been reduced in the prison population, are not necessarily people who did not have drug offenses as a reason for their being in prison. It's that they had subsequently other offenses that classify them for longer term sentences. You know, if you're in drugs in New York, you're buying and selling drugs. If you're buying and selling drugs, there's guys with guns around, and there's violence, and you're inevitably sucked up in that if you're a serious user of the most heavily policed drugs, being cocaine and heroin in New York, especially for non-white people. Now, part of that prevention, primary prevention, has to do with policing, and the police being the first interaction with the system. Stop and frisk most notoriously, but also the marijuana arrests, which my friend Harry Levine has documented so well in his concentration on race. And you see this engine replacing the one that used to be there for harder drugs as a way of feeding the carceral state here in New York. Without necessarily putting people in for long-term prison sentences, but certainly putting them in jail. Although Rikers' population, which peaked at 23,000 in the early 80s, is now down to 13,000. But there are still 10,000 correction officers working there. So prevention at that level of the policing strategies and police themselves and what they're doing in terms of public safety are a major place to look at primary prevention, not getting people caught, infected, as it were, in the criminal justice system. Next thing is secondary prevention. All right, you're on the program. You've got a record, you're in jail. You can't read the gray part, I see. So secondary prevention is reducing the harms, and so harm reduction comes in, of arrest and detention and imprisonment. Solitary confinement. You know the horror show of solitary confinement with 5% of the world's population, we have 25% of the prisoners, we have 55% of people in solitary in any given day. And the use of solitary has gotten out to the grounds that they violate torture conventions at this point. There's an attempt to put a 50-day cap on use of solitary. I heard about a case yesterday of somebody, young man, who was in for 13 months in solitary. So the campaigns to stop solitary, coming out of the human rights community especially, are beginning to have an effect and need to be on the street. Secondary prevention. Tertiary prevention, challenging punishment is an example of tertiary prevention because it goes to the heart of the intent in a retributive justice system. And what replaces a retributive justice system, think of the word amnesty, a piece I just published with Mike Trace from the United Kingdom, in which the British are also, and the Europeans are beginning to think about amnesty pardon models, not just to decompress the size of the criminal justice population, but to shift the terms of reference to recognize that wrongs have been done to these people, not just by these people, especially when those wrongs have been pointlessly designated as a cause for extended incarceration. Eric Holder, Attorney General, recently said putting too many people in prison for too long for the wrong reasons. So having gotten to that point, we realized we should stop doing what we've been doing, and it has happened in New York State. It leaves behind a very important piece of business that we haven't dealt with, and that's the people who are in prison now from the previous crop of long mandatory sentences. 340,000 people in American prisons for drug offenses who are sitting there now, and another 1.5 million on correctional control in the community, parole and probation, which is the engine that gets them back into prison because they violate and fail the tests, most often drug tests and administrative missing appointments. So the concept of amnesty here is not just to, going forward, to overlook or not prosecute drug use, which is what's happening de facto in places like California, to begin to try to make amends with those people we've damaged so much. There's a moral obligation here. I don't know if reparations is the right word, but that's why amnesty comes like, because to start on the business of reconstructing the self-respect, dignity, and entitlement to be human beings in the community for all those millions and millions of people who've been through the system. It's about 8 million now who've been through the criminal justice system in this burst of incarceration. And that's a population that we have to do more than say I'm sorry to for our mistakes. If they're sitting in prison and sitting on a parole system and under restrictions that make it impossible for them to function in the community, we have to remove those shackles, just as much as we had to remove the shackles from slaves. Thank you.
Could you please give another hand for this amazing panel? And apologies for the technical challenges of seeing the PowerPoints. We could see it very clearly up here, very stimulating, amazing stuff. So this is it. This is, she said arrogantly, this is the framework that you get to go through the rest of the conference with and unpack, and there will be plenty of opportunity to unpack many of the issues that the panel discussed at more depth with a wide range of expertise, but this certainly sets the stage. When the war is over, when mass incarceration ends, it is clear from these panelists that we still have so much work to do. And will we learn from recent actions, our past, and consign our young people to more bad public policy that has collateral consequences that will continue to reverb forward in generations. I will put on my policy wonk hat for a second and just underscore Ernie's remarks about the opportunity of the federal healthcare reform, ACA, Obamacare, tomato, it's the same thing. But it is an amazing opportunity for a paradigm shift in using the criminal justice system as healthcare and the first response versus using health as the first response. Legal Action Center, shameless plug, has done a lot of work around looking at behavioral health issues in particular and how they will be provided for in federal healthcare reform. And in New York State, and as someone who's very young but still has lived through 2 Cuomos, right, Ernie? We've lived through 2 Cuomos. We'll live through maybe a 3rd Cuomo. One of the first things that Andrew did when he took office was to close prisons because the prison population demanded it. It was reduced. But he also undertook a very aggressive redesign of our Medicaid system, our healthcare system. And I don't think that the two were accidents. And it prefigured what was coming and how New York was going to be able to address what I would like to say, poor prioritization of public safety over public health. Both are important, but one cannot be robbed to enrich the other. So we have 10 minutes, and we have microphones, and I wasn't told that we were supposed to do some question and answers, but I see somebody very esteemed who's at the microphone. So, Dr. Roberts, can we do a little bit of question and answer, or will that run us over time? Sorry? Yes, please? And please forgive me, I have a very firm moderator hand.
Yes, good morning. I'd like to thank the organizers of this conference and indeed the esteemed panel who did a tremendous job of setting the framework. I don't know if it was by accident or if it was destiny that the last word was said reparations. Reparations has 3 aspects: restitution, compensation, and rehabilitation in the international arena. And indeed, this is a human rights discussion, and of course that's going to come out throughout the conference. But as someone who practices, my name is Amani from Reality House, as someone who practices at the bottom of the system in terms of implementation of policy, in terms of drug treatment, I'm constantly faced with the challenge of how do I get you as researchers who produce knowledge to the 2nd stage of the transmission of that knowledge, to the 3rd stage of the implementation of that knowledge. And it seems to me that our work is so arduous that we seem to be in our silos. Not really, we don't choose to be, but if I didn't take the day off from my work of treating patients to come here, I wouldn't have gotten this knowledge. So my challenge to the panel is, how do we begin to break out of the silos, given the work that we have to do, such that we can create a critical mass around the information that's being produced here, so it doesn't stay in the ivory towers, but actually gets down to the places where the treatment is where it takes place. At Reality House, we work with a social justice model. So we're constantly in need of the information that you're producing so it can inform how we design our groups, how we design our programs, and we can begin to offer another stream of data that says this is the approach to drug treatment, not just evidence-based. Thank you.
Thank you. Would any of the panelists like to interrupt, please?
So, do we have microphones? Check, check.
Like, check. It's on.
I think this room is the worst acoustic sort of room I've ever been in. It's a beautiful room, but I wonder if these acoustics is for effect or something. It's just not very good. The question about how do we generate knowledge in science that's helpful for people in the real world, particularly with some of these issues that you all are dealing with. I can speak in terms of my area, and it's drug abuse sort of research. Today, a major focus in drug abuse research is on biology and genetics, the brain, and so forth. It should be. We should have a lot of focus on that sort of thing. It's a great area to investigate, but a disproportionate amount of the information has been focused there. And so there's not really an interest in social justice in my area. We don't particularly care about it. And one way that you make us care about it is that you be vocal for your representatives. Science is politicized. We pretend that it's not. But the priorities are shaped by what the population says is their concern. If you all are not vocal about what those concerns are, we will continue to look for some molecular mechanism that modulates 2% of the behavior. We will continue to do this. And so you all have to be vocal. That means that you have to be honest about race in this country. We have, using terms like racism and discussing racism has become unpopular. You all have to make sure that you call a spade when racism occurs. Hold your political figures to that, your president, all of these folks. If you don't do it, don't expect science to do it.
Hi, my name is Whitney. I just wanted to thank all of the panelists for incredible information, really fantastic presentations. My question was specifically about Dr. Amani, your presentation. I thought it was really apt how you describe sort of the role and pervasiveness of white supremacy in how we frame illness, and I think it's really parallel to how white supremacy frames incarceration, right? About being about the individual, about pathologizing certain behaviors that are associated with communities of color. And you also kind of talked about how that was a really different framework for you as an epidemiologist. So I wanted to know if you and some of the other panelists, if you could speak on it, sort of what does it do in shifting the conversation when we name white supremacy, right? Maybe when we call a spade, and how that changes our analysis about the issues of sort of intersecting, the carceral state and community health. Thank you.
I mean, I think for me, it becomes really important because then it demands an intervention that's not about the individual, right? Calling out white supremacy not only then prevents what I think you were getting at in terms of, okay, if we do get rid of like a racialized mass incarceration, then what are we expecting, right? Are we then anticipating something that also another system of social control that continues to create like disparate conditions for communities of color? So for me, using the word white supremacy then says that, hey, this is not about me, this is not about you, these are not about youth, right, and what they are not doing. It's about a system, right, that's operating in such a way as to like really limit people's potential. And that's not to take away from the resiliency, right, that exists amongst like young folks, right? But it definitely is to say that, over time you've stripped them of opportunities, and these are the conditions that you're setting. So white supremacy is the root of illness, right? So to call it by its name then for me is to actually is to be searching for truth. And I think to get at what the question that you had asked earlier about research, I think that that's one of the things that we can do as researchers ourselves is to challenge ourselves to continuously to recheck our frames, because our frames are one of which we think about the individual as a potential research subject, right? Then we engage communities in this way versus actually going out to communities and wanting to understand like what's going on, how is that they're impacted, help me understand this process so that I can then challenge myself to document it and then go back and put pressure on other people who have more power, right? To then better, funnel resources and redirect them. So thank you both for those questions.
And I think for my work with young people, I'm capturing them at a moment where they're figuring out how the world works and their placement on so many social hierarchies. So their knowledge of white supremacy and racism and discrimination, even at the age of 14, 15, is so key for them to figure out that it's not individual failings, but perhaps something beyond them that may speak about the outcomes of people around them. And so this will influence political attitudes, this will influence their levels of cynicism, this will influence their engagement with all of the great things about civic society, as well as perhaps being very skeptical and asking questions and critical about all the worst things. So I'm really happy to kind of illuminate their perspectives at this formative moment where their behaviors and actions can reshape the trajectory of their lives. So I appreciate your work. I'm happy to do that.
Yes, sir.
Hello, my name is Richard Dario. I'd like to thank you all for coming out. It was a great panel. My question is that in the context of the myriad of purported budget crises across the United States, one would imagine that there is an opportunity for reformers to steer policy away towards the carceral continuum, just the basic penal policy of the state. There was an National Research Council report that said that I can't give you the exact ratio, but for every dollar spent in alternative programs, there's several dollars saved in comparison to what's being spent in incarceration. So my question to the entire panel is, what political roadblocks do you see from preventing reformers from taking this particular opportunity right now and steering policy away from this problem?
So when we think about the economics, and I think we're in a moment right now in terms of drug policy or rethinking drug policy. One of the reasons that I think that we're in this moment is because of these budget constraints. We realize that we can't continue this sort of path that we've been going down. But one of the things that I just like to caution people on is that when we talk about budgets, it allows us not to talk about social justice. And justice is the major focus that's my major focus. So as we see these budget cuts, please don't forget about social justice. That's what it's about. Because when we get more money, we'll find other ways to discriminate against other people, like the war on terror and the rest of these things.
I just have to say this as somebody who works on budget issues. It definitely is a trend. Certainly, as I remarked on, for Governor Cuomo to come into office and to shut prisons, it wasn't social justice based. His father oversaw the amazing buildup of prisons in the first place that then fueled the economic development of an entire part of the state. So the money will definitely be the inspiration as we talk about the cost of prison beds, the cost of jails versus the cost of educating. We do have to do that delicate balance of it's the social justice right thing to do, but we cannot be so naive as to not make that economic development. The embrace of sentencing reform by the conservatives should speak volumes. Yes.
Thank you. Wonderful panel. I'm Lynn Paltrow from National Advocates for Pregnant Women. A question and a comment. Punishment that is brought about in the guise of the war on drugs and played out in explicitly racist ways also occurs through the civil child welfare system. A form of punishment is removing people's children from them, and I hope that Dr. Hart could comment on that. And I just wanted to share an observation. I guest lectured at a Columbia public health class this week, and in terms of preparing people for the incarceral state. It's also the surveillance state. I asked the class, how many of you have been drug tested in relationship to your work? And of 30 students, at least half the students raised their hand, a very privileged group of people. And I asked them, why were you drug testing? Did anybody explain the nexus between your drug test and your job? Most of them had been drug tested by Columbia in order to be teaching assistants. I just wanted to share.
So Lynn, as you talk about what's happening with the children being removed, as you know, you got me involved in this. I would recommend that anybody in the audience, if you want to see modern day slavery be played out, go to family court in Brooklyn. I go and I testify on behalf of these women who are having their children being taken away because they are testing positive for marijuana. Now, you test positive for marijuana, it tells you nothing about functioning. As many of you all know, you can test positive for marijuana weeks after you actually have used marijuana. Like some of you all have used alcohol today or last night. I can test your sweat, your urine, and we can determine that you used alcohol. It's like removing your children away from you because of that positive test. This is playing out in Brooklyn on a daily basis. And when I say it's like modern day slavery, it's not white kids who are being taken away. It's primarily black and brown folks, kids being taken away. And all the players, white lawyers, the lawyers are white, the judges are white, and the overseers, all the security people are black. So it's modern day slavery. And it's open to all of us as US citizens. So I encourage you all to go to Brooklyn Family Court on any day of the week.
I also want to add to that, is this on? I also want to add to that, it's such an important point because so many people have documented the foster care to prison pipeline, right? I think something like, it's estimated like 70% of those who are who are incarcerated at one point had been in the foster care system or had some sort of contact with the foster care system. And then when you think about public health in terms of biomedical interventions there, like right now the psychotropic use in the foster care system is really come under scrutiny. But I think like a study in Texas saying that some like 40% of young people in one of their systems were on psychotropics, with 70% of those on at least 2, right? And this isn't psychotropic plus some sort of counseling. This is just medication, right? So really adding to what Dr. Hart is saying about this is an enactment of slavery, right? It's also slavery with the healthcare state really supporting it.
You are our last question.
Wonderful. Thank you so much. Thank you so much. My name is Shoshana Brown. I'm the program director at Washington Heights Corner Project. And I just wanted to take actually a question that was stated earlier a bit forward. My question is really moving past budgetary concerns and thoughts. I wanted to hear the panel's comments on some of the ideas around capitalism and how capitalism plays into both the criminal justice injustice system as well as healthcare. As some of you may know, the CCA was actually in New York this week doing an analyst day and looking at privatizing prisons across the country, but also particularly it's suspected beginning here in New York, as well as the challenges and struggles between the healthcare fight right now being both private and moving into more of a public sector. So if you could speak more towards past just the government budget, but more towards private concern and capitalism as it relates to these issues, and also how it relates to the directing of your research. So capitalist interest and private interest directing research.
I'm no expert in this matter, but the California Corrections Association, the private prison, the largest private prison company in the United States, they're making a lot of money, and they don't want to stop making money. So, and I think I'm stealing a point from a paper of Ernest I read on the airplane over here, but you know, now that we're seeing less incarceration, a little less incarceration of people for drug-related reasons, they're looking for other ways to keep these facilities full of people so they can continue making money. And one of the issues that Ernest pointed out in his work is immigration. So now people who are undocumented are being used to kind of fill up these spaces so that the you know, profits can continue to be made, essentially.
I think that we do have to accept that we are need to be political activists to make any progress in these areas. And you're not going to do that well with people whose livelihoods depend on business as usual. And the shift, the privatization of the system as it repurposes itself in the face of the drug thing going down. The war on drugs is discredited now in many ways, but the residuals are there, mainly the system that was built around it. And those people, so it's repurposing itself at this point around immigration, around sex offenses, around small-scale economic offenses in which debtors' prisons are essentially re-emerging. And those are very well suited to privatization. In the case of the immigrants, for example, the biggest group of 400,000 having been deported last year, which means that they were arrested, they were detained, they were tortured, and then they were sent off on an airplane. And to be replaced by another bunch. There are about 200,000 in the system now. That's big business, and it's very well suited to the privatization because they don't have any accountability around human rights standards, and this population really has no rights in this society. And one way you have to be very subversive and agitational around this, and I think that means the youth. So is there anyone here from Students for Sensible Drug Policy? No? There's not a chapter at Columbia?
Yeah, there is a chapter, but they're in class.
There you go. Good kids at Columbia. What they're paying, I guess they better do it. But there is a huge population of young people who get it about these issues, and I think we have to dedicate ourselves to supporting them and helping them do it. There's a nice development in that number of the first cohort of SSDP who were college students. There are now dozens of chapters of law students for sensible drug policy, and some of us have begun to work with those students on who will be the future public defenders and prosecutors and judges in the criminal justice system to begin to get under their skin. And I think anyone who has access to these populations of students ought to see that they are at meetings like this, or we take those meetings to them. And I get invited to a lot of law schools now to talk about this stuff. So I think we have to see where our potential, you need a future trajectory on this, and that's definitely youth.
I'd just like to add one last caveat. I just want to make sure that we are clear. The current administration says that they don't use the language of the war on drugs because that language is not appropriate. But please don't get it twisted. We are arresting 1.5 million people every year still for drug-related offenses. And the war on drugs is as intense as it always has been. So please don't get fooled by the language.
And with that, we reluctantly close and go forth and challenge.